Welcome to Expanding Access, a podcast by Behavioral Health Tech, where we explore the cutting edge of mental health, substance use, and autism and IDD care. Each episode features insightful conversations with industry leaders who are driving real change through technology and innovation. Whether you're a provider, payer, or just passionate about expanding access to behavioral health care, you won't want to miss these stories. Let's dive in. Hello, everyone. I'm Solomay Tibabu, host of the Expanding Access podcast, and I'm so excited to have Colleen from Two Chairs here with us. Thank you so much for being here.
Thank you for having me.
Let's just hear a little bit about you and your role and how you got into this space.
Yeah, great. So I am a marriage family therapist by training. I've been in the field 20-ish years, starting my career out in community mental health, but really got interested in how do we really think about quality and access for clients on a grander scale. So more of a digitally enabled, more innovative, as much impact as we can. So really got interested in sort of the startup space in about 2012 and, have helped a couple other companies and joined Two Chairs about 4 years ago, really when we were ready to scale, really scaling high outcomes, high evidence-based approaches with MBC and matching as sort of the sweet spot of what we do here at Two Chairs. It's just the space I love. It's really thinking about how do you bring more quality outcomes to people that are suffering from mental health or behavioral health conditions.
Mm-hmm. And Colleen, for those in the audience who are not familiar, what does MBC stand for?
Oh, thanks. Yeah. So MBC is measurement-based care. You might also hear about it as feedback-informed treatment or FIT. And the idea is that you're using outcomes in the room with the client so that you and the client both are looking at how things are going in care so that you know whether or not to adjust treatment. Similar, like if you were trying to lose weight, you'd get on the scale to see are the things you're doing actually making a difference in moving that number. Similarly, the measurement-based care helps us really understand, are we improving the client's lives and having the clients sort of talk with you in session about those outcomes.
Awesome. I definitely want to ask you a little bit more about that. But a little more for background. Traditionally, behavioral health has kept therapy and psychiatry quite separate. And so we'd love to hear a little bit more about Two Chairs' approach and how that's different and what the impacts have been.
Yeah, so we really believe that therapy and psychiatry should be under one roof. Think about it as therapy or care for clients that are suffering from behavioral health conditions as a team sport. What we typically see out in the world is there's a behavioral health provider that might have therapy, and then you have a psychiatry provider that might have psychiatry, and then trying to help the client navigate that system of care is very complicated. Even just in my own personal life, I've had family members that need care and they have to jump around from provider to provider and start to search over. So at Two Chairs, what we want to make sure is our clients have access to both because we know the outcomes are better for some conditions. And actually, most conditions, outcomes are better when you have psychiatry and therapy together. And also, we need to make sure that we're working on the same treatment plan because clients who are suffering different kinds of conditions need to make sure that both the medications and the symptoms that are being addressed also are being considered in the therapy and what therapy is being offered too. So we want to keep it all together in the same safe place.
So Colleen, I'd love to ask you, just from a patient's perspective, why is therapy and psychiatry under one roof meaningful for them? And what should they be thinking about?
Yeah, so it's really important because you want both of your providers working on the same treatment goals. So an example I tend to refer to is if you're talking to someone or if you're a patient who is experiencing high anxiety and maybe working on exposure therapy as an example, your therapist would want you to actually experience some of the anxiety associated with that exposure so that the anxiety gets less and less the more exposure that you have. If your psychiatrist doesn't know that's what you're working on in therapy with your therapist, the medication that they're prescribing you could actually be reducing the anxiety. And so then they're working against each other actually without even knowing it. And as a patient, you don't want to be in the middle of telling each provider what the treatment plans are and what this one's doing and that one's doing. You want them talking to each other so the treatment is well coordinated. And even better, if it's asynchronously or able to be enabled in the system so that everyone's looking at treatment plans and seeing each other's progress in care, then those two providers can use their specialties and their expertise to make sure that you're getting the right care and the right interventions.
That is such a super interesting use case and one of so many I can imagine where alignment is critically important. So even more reason. Continuing on this idea of keeping folks engaged and not having to retell their whole story, notorious is behavioral health for drop-off. And that's a challenge for both patients and providers alike. Can you talk a little bit about how Two Chairs is keeping patients engaged?
Yeah. So one of the things we're really, really proud of is actually our engagement. Our clients stay in care. We sort of measure at the fourth session, thinking that's the moment to test, like the people have stayed long enough to experience the intervention. And about 94% of our clients stay until the fourth appointment. And when you have psychiatry and therapy under the same house, we also don't have that drop off where you make a referral and you don't know if the client actually ends up seeing the psychiatrist or the therapist. And so we can see in our systems whether or not the referral is going through. We can get somebody in care. So they don't even have to go through the referral process. We can just set them up an appointment and start making sure that the two providers are talking. We also have a care navigation team that helps with that to make sure that we're navigating all the insurance questions and letting clients know what the logistics are so that we're taking out all of the guesswork and making it easier, because it's important that getting clients, I mean, we know this from sort of motivation theory, that when clients are ready for care, you want to get them into care as quickly as you possibly can, because that's when their highest motivation and highest engagement is.
Oh, I love that you mentioned that. It's like that is the moment that people have found the courage to raise their hand and reach out. And it's just so important to connect with them to get them the care they need. There's something else I think I heard, that Two Chairs has achieved 100% clinician adoption of measurement-based care, which is, I mean, that's pretty rare and remarkable. We'd love to hear, how and what's the impact of that been?
Yeah, it's been a journey for us, to be honest. It's been, 8 years now that we've been working on getting that 100% number. And the reason we've done this, we really use sort of implementation science to think about how do you make something really implemented throughout the entire organization. So one, we train all of our clinicians in this, because we know in the world, in the field, it's only about 20% of people actually endorse using measurement-based care. And even then 5% say that they actually use it on a regular, every session kind of basis. So we know the burden's on us to train clinicians on how to use measurement. And that's really important first and foremost, because you have to have clinicians really buying into the model and understanding the model. So for example, one of the measures that we track is an alliance measure. And if clinicians are approaching that alliance measure with the wrong mindset, they might be approaching it like a Yelp review, like, please give me 5 stars. My boss is looking at this. And then it's not actually working in session, because what you really want is the client to be honest, but to give you an honest reflection of how they're feeling about care, whether they feel like they're making progress on their goals and whether they feel like this relationship is the right relationship for them. And so we need clinicians to understand that that score is a conversation with the client in the room, and you to be approaching it as really feedback. So how do we use this feedback to adjust care and to hear what's working or not working for the client? So we took the training on. We've spent years of just really getting the clinicians to understand sort of MBC and how to do it in the room. But also we implemented it throughout our whole system. So we have it as an expectation across the team, so we can track whether measures are being collected, and nearly 100% of our clients are completing measures. And then we have our product, which we call our care platform, actually is set up so that clinicians can track the trends of the different outcomes that we're tracking, and the clients can see them too. So all of that system, training, outcomes, performance expectations, all the things implementation science tells us to care about, we've implemented. And because of that, we can now say that 100% of our clinicians use it.
I can't imagine the nuance that must go into that. It's really amazing.
Yeah, we're really proud of it, and really proud of our clinicians, because they actually are getting outstanding outcomes as a result of all of that, which is what all the research on feedback-informed care says. It's when you use outcomes in the room, you get better outcomes, and we're seeing that. And we're about to actually have a peer-reviewed paper that actually shares that too. So excited about that. Yeah.
Wow. Oh, well, Colleen, another topic that, of course, I've got to ask about is value-based care.
Yeah.
So another thing that has been rare to successfully implement in behavioral health. Can you talk a little bit about the approach of Two Chairs building a shared risk partnership and, of course, integrating measurement outcomes in that?
Yeah, absolutely. So we really believe that our outcomes speak for themselves. So we try, anytime we get into a relationship with a partner, to set up the relationship in a way that our outcomes are what we're being held to. We call our clinical outcomes meaningful improvement, which basically means there's significant improvement on the GAD or the PHQ-9 without the other one getting worse. And that's how we measure sort of our impact. Obviously, depression and anxiety are pretty comorbid together, so we want to make sure we're looking at both of those at the same time. So that's an outcome we really like to put in our agreements, is to have a level of agreement on what level outcomes our clients will actually achieve. But we also think just as important is engagement. So that number I was talking about before, clients staying in care up until at least the 4th session. The reason we measure that is we know that there's a lot of therapy shopping out there in the world. So if you don't get the client to the right provider on the first try, what ends up happening is they try once or twice and then they sort of drop out of care or think care's not for them. And we want to make sure that most people are staying in care long enough to really benefit from therapy. And then long-term, we would like them to stay for the entire course of care. So, at the fourth session, we have about 94% of our clients staying past that, which is in the field, it's about 36% that people are making it to that number. So it's significantly higher. And we believe that's because of our matching, that we're able to really get the client to the right therapist at the right time, right from the beginning. So those are some of the values that we really put into our contracts to make sure is both outcomes and engagement. And then there's other arrangements too, depending on our partners and what's important to them too, that we really want. But as a field, we would like to see the field move towards value-based care. We've been talking about it for years. And to do that, I really think we need to come up with unifying agreement on what quality is and how to define it, because it's defined in different payers and different partnerships and different providers across the field. And that makes it hard to really know apples to apples, like, are we actually getting similar or different outcomes? And for us, that's our North Star. So we want to get exceptional mental health care and exceptional outcomes. And so we want that in our agreements.
If I could ask a follow-up, do you have any advice for payers that, I've heard value-based care and behavioral health, we're really ready to get this right this time. What should they consider?
Well, I think there's a lot of things they should be thinking about. One is thinking about the amount or the population-based outcomes that you're going to be able to be thinking about. So how many clients are getting this intervention that are referred over? So engagement referral, and then thinking about defining that outcome as something that is uniform across their payer mix so that we're all looking at care in a similar way and measuring it in a similar way. I think as a field, we struggle with trying to come up with a unified definition of what quality means. And I think payers could be working on that as well. But also some of the things I've already talked about, like I do think engagement and client retention in care is as equally important as the outcomes on the back end, because in my mind, that's waste. And if access is the number one thing we're trying to drive, we think about it as quality access. So we want to make sure they get into the right care. Otherwise, we have that therapy shopping happening. And then you also have clients that could have been using that hour of therapy that someone else used if they were being matched to the wrong person.
Yes. So many, the opportunity cost, getting a limited provider, just so many reasons. So
yeah,
it's really great. Even just seeing the great work that Two Chairs has done, I have a lot of hope for the advancements in these last few years. But of course, we can't be a behavioral health innovation podcast without me asking, where do we go from here? Where do you see the future of behavioral health heading, and particularly around this topic of defining success for payers?
Yeah, I mean, probably it's naive not to talk about AI, because AI is sort of changing the whole world and how we approach things. So I really think about how do we use AI in a clinically responsible way, because I think there's a lot of benefits that we could gather from clinical insights and or documentation support, and really thinking about how do we just grab onto this technology that is brand new and make sure that it's being managed in an ethical and competent way so that clients are benefiting from that. So there's a lot of, I think, innovation coming with AI that I'm excited to see where it takes us.
Yes, so much. Yeah, it'll be the next episode.
Yeah.
Well, thank you so much, Colleen. You're just a wealth of knowledge, and grateful that we could share these insights with our community.
Appreciate it. Thank you so much for having me.
Thanks for tuning in to Expanding Access. We hope you're feeling inspired by today's discussion. If you've enjoyed the episode, subscribe and share it with your network. For more content and opportunities to get involved in transforming care, visit behavioralhealthtech.com. Until next time, let's keep pushing boundaries and expanding access together.